Surge Learning. This presentation must be supported with your organization's policies and procedures and your provincial legislation for maintaining temperature in long-term care and residential care homes. Today we will talk about the body's response to exposure to cold, the elderly's susceptibility to cold, the legislative requirements for indoor temperatures, the effects of prolonged exposure to cold, symptoms of cold weather-related illness, first aid measures, and safety of workers working outdoors in cold temperatures. The body is marvelous as it maintains balance or homeostasis to regulate our body temperature between 35 to 38 degrees Celsius. When exposed to cold temperatures, your body begins to lose heat faster than it can be produced. Your body will preserve heat by favoring the internal organs and thus reducing the flow of blood to your extremities under cold conditions. Hands and feet tend to get cold more quickly than the torso because they lose heat more rapidly since they have a higher surface area and they are more likely to be in contact with colder surfaces than other parts of the body. Prolonged exposure to cold will eventually use up your body's stored energy. Cooling of body parts may result in abnormally low body temperature and various cold injuries. As you care for the elderly, you have noticed that they feel the cold far more than you do, and are often seen wearing sweaters on hot days. As a person ages, the walls of their blood vessels tend to lose their elasticity, which reduces circulation. The fat layer under the skin that helps a person stay warm also decreases. Finally, as you age, your metabolic response to the cold slows down. All of this contributes to being colder when you are older. Many factors also influence the elderly's ability to maintain stable body temperature and stay warm, including illness and medication use. For example, lack of activity affects body heat. Thyroid conditions cause an increased sensitivity to cold temperatures. Diabetes can keep blood from flowing normally to provide warmth. Parkinson's disease and arthritis can make it hard to put on more clothes, use a blanket, or get out of the cold. Memory loss can cause a person to underdress or go outside without the right clothing. And medication use for hypertension, such as beta blockers, which decrease a person's heart rate, reduce the circulation of the blood to the feet and hands, and causes he or she to feel cold. Provincial requirements are set for the long-term care homes and personal care homes. The air temperature must be maintained at a minimum of 22 degrees Celsius in all spaces occupied by residents and all common spaces. Living in a cold house, apartment, or other building can cause hypothermia. In fact, hypothermia can happen to someone in a long-term care facility or residential home if the rooms are not kept warm enough. Or you may find that residents find the room too warm and open their window wide for an extended period of time. They could fall asleep and be susceptible to hypothermia. Pay attention to the inside temperature when at work and to whether the residents are dressed warmly enough with sweaters and heavier pants or dresses. Ensure they are wearing socks and slippers, and you can offer a blanket for their lap. Offer them warm fluids to help them stay warm. Families may wish to bring in small space heaters for their loved one's room, but that is to be discouraged and or prohibited as it poses a risk of burns to the resident and can be a fire hazard. In moderately cold environments, the body's core temperature does not usually fall more than 1 to 2 degrees Celsius below the normal 37 degrees Celsius. because of the body's ability to adapt. However, during prolonged exposure to cold without adequate clothing, the body is unable to compensate for the heat loss, and the body's core temperature starts to fall. Prolonged exposure to cold will eventually use up the body's stored energy. The result is hypothermia, or abnormally low body temperature. A body temperature that is too low affects the brain, making the person unable to think clearly or move well. This makes hypothermia particularly dangerous because a person may not know it is happening and will not be able to do anything about it. Residents who go outdoors for long periods during cold weather, sometimes without appropriate clothing, or who wander away, are at risk of weather-related illnesses. Residents who elope or may exit to a courtyard for an extended period of time unbeknown to staff are at serious risk of injury and even death. Staff who work outdoors in extreme cold are also at risk. The most severe cold injury is hypothermia, which occurs from excessive loss of body heat and the consequent lowering of the inner core temperature. Hypothermia can be fatal. Non-freezing cold injuries include chilblain and trench foot, while frostnip and frostbite are freezing injuries. Toes, fingers, ears, and nose are at greatest risk because these areas do not have major muscles to produce heat. If the eyes are not protected with goggles in high wind chill conditions, the corneas of the eyes may freeze. So what are some of the warning signs of hypothermia? Sometimes it's hard to tell if a person has hypothermia. Look for clues. Is the room very cold? Is the person not dressed for the cold weather? Is the person speaking slower than normal and having trouble keeping his or her balance? Symptoms of hypothermia can vary depending on how long the person has been exposed to the cold temperatures. The sensation of cold followed by pain in exposed parts of the body is one of the first signs of mild hypothermia. As the temperature continues to drop or as the exposure time increases, the feeling of cold and pain starts to diminish because of increasing numbness. If no pain can be felt, serious injury can occur without the person even noticing it. Some early signs of hypothermia include cold feet and hands with a feeling of numbness, puffy or swollen, pale skin, shivering, slower than normal speech or slurring words, acting sleepy, loss of coordination, unable to perform complex tasks with hands, and confusion and disorientation. Some of the later signs of hypothermia include moving slowly, trouble walking or being clumsy, stiff and jerky arm or leg movements. The shivering will stop, and exposed skin may appear blue. The person may be incoherent or have irrational behavior, dilated pupils, and pulse and respiration rate decrease. Severe hypothermia looks like loss of consciousness. A pulse may not be obvious, and death may occur due to cardiac and respiratory failure. In this activity, let's organize the do's and don'ts of caring for hypothermia. Using your options on the left, click and drag them into the appropriate column, do or do not. Once you have organized them into their appropriate categories, click Submit to continue. Close, but that is incorrect. Here are the answers we were looking for. Chilblains are a mild cold injury caused by prolonged and repeated exposure for several hours to air temperatures from above freezing. Trenchfoot is wet cold disease, resulting from having damp, wet feet for a prolonged period of time. Injury occurs because wet feet lose heat 25 times faster than dry feet. Therefore, to prevent heat loss, the body restricts blood vessels to shut down circulation in the feet in damp or wet environments from above the freezing point. An onset of symptoms may range from several hours to many days. A similar condition of the hands can occur if a person wears wet gloves for a prolonged period under cold conditions. In the affected skin area, there will be redness, swelling, numbness, and tingling pain. Workers suffering from trenchfoot should remove shoes or boots and wet socks. Be sure to dry the feet and avoid walking on the feet, as this may cause tissue damage. Frostnip is the mildest form of a freezing cold injury. It occurs when earlobes, noses, cheeks, fingers, or toes are exposed to the cold and the top layers of the skin freeze. The skin of the affected area turns white and it may feel numb. The top layer of skin feels hard, but the deeper tissue still feels normal or soft. Frostnip can be prevented by wearing warm clothing and footwear. Frostbite is an injury to the body caused by freezing. Frostbite causes a loss of feeling and color in the affected areas. It most often affects the nose, ears, cheeks, chin, fingers, or toes. The person will feel numbness, aching, stinging, and have bluish or pale waxy skin. Frostbite can permanently damage body tissues, and severe cases can lead to amputation. In extremely cold temperatures, the risk of frostbite is increased in residents or workers with reduced blood circulation, and who are not dressed properly for the outdoor temperature. Residents and workers suffering from frostbite should be treated gently. Be sure to check for signs of hypothermia. Seek medical attention on site or send to hospital based on their condition. Bring the person into a warm room as soon as possible. Unless absolutely necessary, do not have the person walk on their frostbitten feet or toes, as this can increase the damage. Slowly warm their skin by wrapping the person in blankets or providing dry clothing as needed. Immerse the affected area in warm, not hot, water. Loosely cover the affected area with a sterile dressing. Place some gauze between the fingers and toes to absorb moisture and prevent them from sticking together. Be sure to also give the person warm liquids to drink. When providing first aid for frostbites, don't rub or massage the frostbitten area. Don't apply direct heat, such as heating pads, heat lamps, or hot water bottles. Don't have the person walk on the frostbitten feet. It is essential for the staff who are working outdoors, clearing snow and performing other duties outside in the winter, to be aware of the risk of repeated or prolonged exposure to extreme cold air temperature. Precautions must be taken to avoid suffering a cold stress. When you work in extreme cold, most of your body's energy is used to maintain a consistent inner temperature. However, there are limits to what your body can adapt to. Cold stress occurs when your internal body temperature is lowered. Cold stress can be dangerous to yourself and your coworkers. There are early warning signs. The staff member may stumble or fumble as he or she has trouble moving hands and feet to complete the outdoor task. He or she will be cold and shivering. If they do not pay attention to these symptoms, it could lead to chilblain, frostnip, frostbites, and hypothermia. Cold weather is a workplace hazard. Like all hazards, employers must have a plan to control or eliminate dangers associated with working in the cold. Where there are no maximum or minimum exposure limits for cold working environments noted in the Canadian Centre for Occupational Health and Safety Regulations, there are guidelines that can be used to conduct work and monitor conditions to protect the health and safety of workers who may be exposed to cold temperatures. The employer's plan must include providing a heated shelter and use a work and warm-up schedule. Using a buddy system so workers don't work alone in the cold. Scheduling work during daylight hours. Allowing workers to work at their own pace and take extra breaks if needed. Educating workers on cold weather hazards and plans in place to protect them. Providing insulated clothing if needed. Monitoring workers who are at risk of cold stress. Having a means of communicating with workers, especially in remote areas. Acclimatizing new workers and those returning after time away from work by gradually increasing their workload and allowing more frequent breaks in warm areas as they build up a tolerance for working in the cold environment. Workers also have responsibilities to protect themselves and their coworkers from cold stress or injuries. This includes knowing the symptoms of cold stress and cold weather-related injuries. Dressing properly is extremely important to preventing cold stress. Dress in layers of warm clothing, with an outer layer that is wind-resistant, and cover exposed skin. For example, wear at least 3 layers of loose-fitting clothing. Layering provides better insulation. Wear a hat that will cover your ears as well. A hat will keep your whole body warmer and reduce the amount of body heat that escapes from your head. Wear insulated gloves to protect your hands and insulated and waterproof boots to protect the feet. Stay dry, including taking steps to prevent excess sweating, which can increase the rate of heat loss from the body. Be sure to keep active and maintain a work and break schedule. Breaks should be taken in a warm area. Today, you have learned about the need to maintain safe indoor temperatures to protect the vulnerable elderly from cold weather-related illness. You will be able to recognize the signs of exposure to cold and use first aid measures to treat the symptoms. Staff working in cold temperatures will also be aware of the risk and know the safety precautions to take while working outdoors. Thank you for joining us today for our module on cold weather-related illness, a module brought to you by Surge Learning.